So some of the contributing factors to the development of PTSD is that there's typically more intensity. It's longer timing, right? That there can be epigenetic and in utero influences. We're going to go into each of these more deeply. I just want to kind of name them here. There can be disruptions in early attachment. There can be poor modeling of health-promoting behaviors in the home, and the presence of a learning disability. There can be cultural and social risk factors and a lack of resilience factors. So let's go into each of those here. So what we know is that not only is complex PTSD associated with longer duration and greater intensity, but that there are also some critical timing points in which one might be more susceptible to abuse or to neglect. And of course, young children in the first 3 years of life is one of those time periods.